Our show is going to be a little different this morning because the Erickson Advantage is under Medicare, and they have specific things that they need you to know. So I'm going to let Karen Boyce introduce us to our representative, and then we'll go from there.
Thank you. Good morning.
Good morning.
Thank you for having me on again. So this morning or today with me is Kathleen McCoach. She is the Health Insurance Resource Manager and representing Erickson Advantage. Recently, Kathleen and I met and we're just talking about it. You know, Erickson Advantage is on the community. It's another resource available to residents.
Yes.
So we thought it would be a good idea for her to come on the show with me this morning and just give our audience some information about Erickson Advantage, dive in a little bit more and just share some information with the community at large. So I am going to turn it over to Kathleen and she'll be able to give some information overall about Erickson Advantage.
Okay, welcome Kathleen.
Thank
I
you
think
for
this
inviting
is probably a good idea because we have lots of new residents that may not know the details on Erickson Advantage. So we have a list of questions and Kathleen's going to answer them, and hopefully she'll answer your questions, and if she doesn't, you know what she looks like and where she is and you can ask her. So can you tell us about the Erickson Health Plan?
Sure. The Erickson Advantage plan is a customized plan designed for the residents of our Erickson communities around the country. The reason for it is that our communities have been designed so everything is integrated into one. People living here, having services available for them, for our residents. We have the medical center here, so Mr. Erickson approached Capitol Hill and United Healthcare, who is our partner, and designed a program that would be exclusively for people who live in our communities that would have extra benefits and customized benefits to better meet the needs of our residents as opposed to some of the other Medicare programs that are out there beyond our fences.
That's great. So who's eligible?
The people who are eligible, first of all, you have to live in an Erickson community. Second of all, you must have Part A and Part B of Medicare. And number three, you cannot have end-stage renal disease, which would mean you would have be on dialysis. And that is a Medicare rule. If you join and later on develop end-stage renal disease, you will continue to maintain your benefits, and there are other programs that Medicare has for people that have those specific needs.
Mm-hmm. Okay, tell us about the different plans and benefits.
Thank you. We have 5 different programs. We have one specifically for people who primarily have VA prescription benefits, and that's called the Signature Plan Without Drugs. We have the Signature Plan with drugs, and that's the most common one that people have because it incorporates all the Medicare benefits and includes the Part D prescription drug plan as well as some extra benefits. We have a Champion Plan that is a special needs plan that meets the needs of people who have coronary heart disease or diabetes. We have a Freedom Plan, which is a lower costing plan that meets the needs for people who just want to have a plan that without extra benefits.
Just a basic plan.
Just the basics, yes. And then we have a Guardian Plan that's specifically for people who are in long-term care.
Mm-hmm. Sounds like it's pretty well covered.
We try. We try. We're still always trying to come up with better ideas.
Okay, tell us a little more about the Freedom Plan.
The Freedom Plan, we also, among us, we call it the pay-as-you-go plan. It was a plan that was designed with a lower premium. It has all of the benefits of original Medicare A and B. The reason why we call it pay-as-you-go is as you're using the services, your co-payments are higher, but it helps to reduce the actual premium of the plan. Our plan's currently $49 a month, but as you use plans, you will be paying for doctor's office visits, specialists, and other services as well.
So it depends on how healthy you feel you are.
Exactly, exactly. And you're still have the safety net that there is a maximum out-of-pocket limit, so you don't feel that you're totally exposed.
Okay. Now, this next question is a little lengthy, but what are some of the additional benefits compared to original Medicare that members receive when they join Erickson Advantage Signature or Champion plans?
Thank you for asking. The most popular benefit is our transportation benefit. This is a benefit where we provide 24 one-way trips or 12 round trips to participating doctor's offices within a 30-mile radius of this campus. The members will not pay for it. It gets coordinated through the transportation department and our member services person here on campus, who is Tanya Sampson.
Sounds interesting.
Oh, and then you asked me more. We also have a hearing aid benefit. The hearing aid benefit allows our members to get a special rate on hearing aids. You have to go through our provider. If you get the inner ear style hearing aids, you only pay $380 per ear. If you get the out of ear style, it's $330 per ear. They have a 1-year guarantee. You get a 70-day full money back guarantee. You get the first 6 months of batteries included. And it's a very nice package to try. Several of our members have used this program and are very satisfied with the quality of their hearing aids. We also will pay for our members to go to the falls prevention program that we have here on campus. That's where it through our fitness center, it helps our members learn better ways to learn balance and strength, so to prevent falling. And I believe the normal cost is $100 to go to this program. We will pay the $100 for our members to go. We will also reimburse our members $100 every 24 months towards glasses and frames. They can go anywhere they want to pick up the glasses or frames. They just bring the receipt into our office, and we will arrange for their reimbursement.
Sounds good. Sounds good. What about emergency care?
Emergency coverage is covered worldwide. There may be a $50 copay, but if you're admitted into the hospital, that is waived. So whether you're having an emergency here on campus, have it out in California while you're visiting a family or friend, or you're overseas, you do have coverage.
Very good. Now, do you still need to keep your original Medicare benefits?
Yes, you do. You must have your Medicare Part A and continue paying for your Part B Medicare benefits in order to be part of a Medicare Advantage plan like Erickson Advantage.
So can I see any physician?
Yes and no.
Okay.
All right, the caveat is when you are on Medicare, you really need to make sure, first of all, that you're seeing a doctor who is a Medicare approved doctor, because that way they're going to approve the payment schedule that Medicare has designed. So with our plan, first of all, you can maximize your benefits if you're using an in-network Erickson Advantage doctor, which would be an in-network Medicare approved doctor and United Healthcare doctor typically. Our members can use doctors outside of the network. The rule for that would be, first of all, they need to make sure that the doctor accepts Medicare, and second of all, will they be willing to bill Erickson Advantage or United Healthcare, and they can see that particular doctor.
Okay, so that not too limiting.
No, but if they do see a doctor out of network, they will pay a higher copayment.
Higher fee, yeah. Okay, what are some of the added features you'll receive when you join Erickson Advantage?
A unique feature that we have in our program is that we have a member services person on campus, and we also have a nurse care coordinator. These two people are part of my team. Their office is directly across the hall from the medical center. Our nurse care coordinator, Betsy Boyle, she is here to help our members if you're going to have a procedure, if you have questions about any directive the doctor has given you, about if you have questions about your prescriptions, if you go into the hospital or go into Garden Ridge, she's there to follow through and be part of your care coordination, as well as your what is the word I'm thinking of right now? When you're leaving the hospital, your discharge planning. Sorry about that. And then Tanya is our member services representative, and she is there to answer benefit questions for you. She helps you to coordinate any of the reimbursements that you get for your glasses or going to the falls prevention program. She helps with the transportation coordination. She is there to be by your side to help you understand your benefits better. And instead of calling a 1-800 number like most people have to call with a plan, they are there to eliminate that. So if you get a bill, you don't understand it because the bills are very confusing.
Yes, they are.
You could take it to her or even Betsy, and they will explain what that bill means, and if it needs to be researched, Tanya will research it for you and get back to you, and you don't have to worry about the 1-800 number communication.
Sounds like lots of advantages. Okay, do residents pay a monthly premium?
Yes, our members do pay a monthly premium with our signature plan with drugs and our champion plan, which is for the people who have coronary heart disease or diabetes. The premium is $190 a month, including Part A, Part B, Part C, and Part D benefits. Freedom plan is $49 a month. The signature plan without drugs is $149 a month, and the Guardian plan, which is the plan for people in long-term care, is $29 and I believe 30 cents per month.
Okay. Now, would residents have to continue paying for their Medicare supplement insurance?
When you're on a Medicare Advantage plan like Erickson Advantage, it would be a replacement. You would not need to have both a Medicare supplemental and the Medicare Advantage, because the Erickson Advantage plan does have all the benefits and more than Medicare Part A and B. It incorporates Part D and other benefits as well.
So if you've been carrying something when you move in here, you might be ahead of the game if you go to Erickson Advantage instead.
It's possible. It's not right for everyone, but that's the advantage of coming to see me, and I can actually sit down with our residents and do an insurance review. And very often I do tell people, especially if they're on TRICARE or other benefits, that you're better off staying where you are unless this or this may happen and affect your life later. Then you may consider it. But I do not try to sell anyone when they come into my office. It's really about looking at what they have and seeing what's best for them.
Just helping them evaluate their
Exactly.
situation. That's great. Okay, if residents don't join Erickson Advantage, can they still use the medical center? I have actually gotten this question from people.
Absolutely, you can use the medical center, and in most cases, their current insurance policy will cover their insurance. There are a few that do not participate with our medical center, but most do.
Yeah, right. I think it's a good idea to have at least a contact, because you never know when something's going to happen that you need help right now, and with the doctors right here.
That's the other part of what I do too. When I first meet with new residents, I strongly encourage them to finish filling out their registration information for the medical center, because even if they're not planning on using the medical center on an ongoing basis, they should get registered with the medical center for a couple of reasons. Number one, if you ever need to pull the pull cord and have an emergency, the first people to your side are our security staff, who are EMTs.
Right.
They can access information about you if you are registered, and that way they're better informed to let the ambulance know when they come
Right.
of what any special needs that you may have.
Exactly.
The other reason is that if you wake up one morning and you are not feeling well enough to go off campus to see your regular doctor, that you can actually see the medical center the same day if you are already
If
registered.
you're registered.
So that's important to be
It is.
registered.
It is. And how could residents find out more about Erickson Advantage?
call me. My
Okay.
office is also,
That sounds simple.
my office is also across the hall from the medical center. I'm not here every day because I do rotate between here and Riderwood, but I'm generally here Mondays and Tuesdays unless something else is happening. Like today, I'm usually here Mondays and Wednesdays, but I'm here on a Tuesday because of today being on TV, and I rotate Fridays. So I am accessible 5 days a week by phone. I always do get back, so please call me if you have questions.
And the support in the office is also there as well. The ladies
Exactly.
in the office is also there too. If Kathleen is not here, the ladies that work with her in the office is also there as a support as
Okay.
well, Monday through Friday. So you have that additional support there as well.
Okay, now you have the office here, which is across from the medical center.
In Town Center.
In Town Center. Now, is there an office in Garden Ridge also?
No.
No.
No,
Okay.
but I do go over there. In fact, I'm meeting with staff over there today to keep them better informed of how things are going and any updates that we have about our
Okay.
program.
So it's wise for people to check into Erickson Advantage if they have another Medicare Advantage program, just to see what the comparison is.
It never hurts to just have someone else looking at the program. I have found that when people have met with me, that when they have felt that they had very strong coverage, and I'll just use one example. I met with a couple who moved into one of our communities, and they said, we have really great coverage, we have everything imaginable. So I asked them what they had, and it turned out that they did not have a Medicare supplemental plan. What they had purchased was a plan similar to a hospitalization plan, that if you go to the hospital, you'll get a set dollar amount, and that's all they had. And they really thought they had full coverage. I met another couple that moved from out of state, and they lost their prescription coverage because they moved from one service area to another. So it's really helpful to just double check.
Double check your insurance. Sounds wonderful.
Well, thank
Sounds
you.
wonderful.
There's another good feature to the plan in terms of the hospital. When someone goes to the hospital, typically we talk about having the 3 midnight. Would you explore that a little bit
Yes.
for the audience?
I am so glad you brought that up. I am so
That-
glad.
Yes, that is so
Yes,
confusing
that is,
to people.
I'm so glad you brought that up, because even though we have things we have to follow, we can always miss things. Yes, that is a very big advantage with our program. In most Medicare plans, and in original Medicare, Medicare requires beneficiaries to be in the hospital as an inpatient, not observation,
Right.
but as an inpatient for 3 midnights in order for any of their bills to be paid when they go into a nursing home or go into Garden Ridge. With our program, we have waived the 3-day minimum stay. So our members can go directly into Garden Ridge for skilled care and have it paid for under the skilled nursing benefit, because we've waived the 3-day minimum stays, so they don't have to worry about private pay. For instance, a year ago there was a flu epidemic. Many people, if they needed extra help for respiratory therapy, they had to go into the hospital first, some of which went in for observation. Some of our members went directly into Garden Ridge and had the 3-day minimum stay waived, and they were covered.
It is a good option to let our residents know about, as you said, because as I've been on before and talked about it for Garden Ridge, sometimes you're correct. It is tricky when someone goes to the hospital because you're already sick, you're not feeling well, and if you
That's the
don't,
last thing from your mind.
there you go. And if you don't have sometimes an advocate or someone there to ask the particular questions, am I here for observation or am I inpatient? You could be in for 4 or 5 days,
Right.
but they have you just as observation.
Observation.
And so you're thinking, well, I'm in the bed. I've been here for 5 days. I must be admitted. Not necessarily. And so it can become sometimes a bit of a surprise if they then is admitted to Garden Ridge and we're saying, we're sorry, because of your status in the hospital, you cannot utilize your Medicare benefits, so it's going to be private pay. There's often times when it is a shock.
Yes,
To the
I imagine
person.
it would
What
be.
do you mean? And sometimes they say, well, you need to fix it. Well, we cannot because it's the hospital rules to which they go by. So Kathleen is making some very important points in terms of Erickson Advantage. It is a benefit that's there. If nothing else, it was worth taking a look at the plan and just having her just evaluate it. And as she said, if you have a ideal perfect plan, she's going to say keep the plan that you have.
Right.
And then if there's opportunities where she see you can benefit a little bit from some of the advantages under the Erickson plan, then she'll give you suggestions and ideas of what you can use and show you the comparison. And it does not mean you have to transition over, but at least you will have the information. And you'll be well informed of the opportunities that are there that you can then tap into and utilize. So
It sounds like this 3-day bit is something that we ought to inform those who are helping us, like our children or advocate, whoever, know about, so that they can be aware that when you go in the hospital, they make sure that you're admitted rather than just being there for observation.
And even so, the hospital has a certain criteria
Oh,
as
yes.
well, that even though you'd like to be considered admitted, they cannot
They
admit
cannot
you.
do
They
it.
have to put you in observation.
Right. Okay, we still have a few minutes if you have some other things to talk about. You mentioned something before we went on air that I questioned. What was it?
Oh, yes, thank you for asking me. We are also a 5-star rated plan. Now, what does that mean? That means that Medicare, they actually rate every one of the Medicare programs that are out there in the country. And the rating is based on about 50 different points. Well, Erickson Advantage has been awarded with a 5-star of excellence through Medicare, CMS, which is the Center for Medicare and Medicaid Services. We are celebrating our 5-star program. It provides us a few things. Number one is now we are not restricted, or our residents are not restricted to join our plan just during open enrollment now. They actually eliminate that restriction, so anyone who is interested in even learning about our program or transitioning over to our program can do that any time during the year now, which is absolutely
That's
wonderful.
Yes.
Number two, we are celebrating by providing hot chocolate and hot apple cider and snacks next Tuesday afternoon at 1:30 in the Akatink room. I can never pronounce that correctly. In the Akatink room. So please, anybody here on campus, please come and join us. And then we'll get to know each other better, and we'd really like you to come and just help us celebrate this wonderful award that we have been provided by Medicare. And it is really very special because very few plans in the country get a 5-star plan.
And that's the top.
That is the top rated.
and just say again for the audience, that's next week, Tuesday,
Correct.
in the Akatink room,
Correct.
which is in Village Square.
In Village Square.
And from what time to what time? About?
I believe it's 1:30 to 2:30. I should have written that down, but I believe it's 1:30 to 2:30. But flyers are going to be going out, and it is going to be advertised. So just look for the advertisement in your cubby.
Okay, very good. Sounds exciting.
Thank you.
It
It is exciting.
And it'd probably be a good time for folks to come by if they have questions or they
Right.
would like to, pick Kathleen's brain and just get a little bit more information. It's a relaxed social time, so come on by and, ask a couple questions, get some more information.
Certainly.
And so it'll be just nice socialization time to come by.
Right.
Sounds great.
And my team will be there as well, so Betsy and Tanya will be with me, and so you can get a chance to get to know them better. I work with Betsy a few times a week, and she has a steady stream of people coming in to see her on a regular basis. And Tanya, we share a desk, so I don't see as many people coming in to see her because usually she's at Riderwood when I'm here.
Oh, okay. Okay.
But I understand she's got a pretty busy
That's
schedule.
great. Okay. You have anything else to add? We probably have a couple of minutes yet.
So I think that was good. Again, I wanted to bring, Kathleen and I have partnered. We met and we talked about it, and just trying to get the message out to the Greenspring community at large to say how can we make sure folks is aware that the Erickson Advantage plan is there, and to, as everything else when I come on, having information is always a good thing.
It is.
And having information before we actually need to use it, whether it's the services of the Erickson plan, or even as I talked about before, about just coming over and touring Garner Ridge and becoming familiar with the environment. That way it's not such a, oh my goodness, Garner Ridge, because I cannot say it enough. When an emergency situations occur, we're already stressed, we're already feeling anxious. It's good to know that, okay, I'm familiar with Garner Ridge. Oh, you know what? I did look into the Erickson plan and I have it, so I know if I'm in the hospital, I can, you know, if they discharge me, I may or may not have to worry about, is it private pay or can it tap into my benefit? So there's lots of good opportunities
Right.
just to get information ahead of time
It is.
before something does occur.
Another
is.
way too is most of our residents either rely on a family member or friend to help review their benefits.
Right.
So I invite family members to call me anytime about our programs, because it is nice for them to know what other options are out there for their family or loved ones as well. So I invite them to give me a call. My number, I only know my cell number, 703-209-9626. So just give me a call.
Yep. Okay. Sounds wonderful. Thank you so much for coming on and giving us all this new information.
Thank you
And
for having